Welcome to the Senior Scoop, where experience meets community. Hi, I'm Deborah Samuel.
And I'm Kelsey Samuel. We're your hosts, bringing you real Santa Barbara stories, trusted advice, and expert tips for seniors and their families. The Senior Scoop is proudly brought to you by SBSOS, your local support network for seniors. You can visit us at sbsos.care or call us on 805-946-0060.
Now, let's dive into this week's Senior Scoop. Welcome to another episode of the Senior Scoop. Our warm and informative podcast is dedicated to supporting seniors and their families throughout life's major transitions. Today, we are delivering an important yet often avoided topic, pelvic health. Who would have thought? As we age, maintaining control, comfort, and confidence is vital, and this conversation will help you understand how pelvic health floor issues impacts overall wellness and life. Our goal is to help you with practical guidance and encourage open discussion so you can age with dignity and vitality.
Thank you so much for joining us. Today we're very pleased to have Natalie Hickenbotham here with us, a licensed physical therapist who spent many years at our local cottage hospital here in Santa Barbara. And she is now really focusing on pelvic health at Heart of Gold Physical Therapists here in Santa Barbara. So this is a topic that is really quite new to me, so I can't wait for us to dive in and really learn more about how you help people with pelvic health, men and women.
That's right, men.
Yes.
Wow. Well, thank you, Natalie, for spending your afternoon with us here at the Senior Scoop. And we're going to talk about a topic that a lot of people, they just may push it on the back shelf and not talk about it until it becomes a problem. And that's why I'm excited about this podcast, is we're going to be sharing a lot of information, and you're going to teach us some of the things that maybe you can do on the front end to help that pelvic health area. So just start us out, like what area of the body are you really working with as a physical therapist?
So as a physical therapist, I think we always work with the whole body. So that's part one. And the pelvis is sort of the center to our body. So the thing that you said is something I often say to my patients, that we don't really think about this part of our body until something goes awry. And then people are really all ears and want to know, what's going on and how can they best manage. So
Or they try and hide it. They're too embarrassed. It's like, I have incontinence or something like that.
Right.
And so it's not necessarily, I race off and go and speak to my PT about this.
Right. And there's all those commercials that show how cute that, adult diapers are now. And, so
Yeah.
we don't want to normalize that too much.
Yeah. And I love the fact that you say it's not normal. I mean, there are things that we can do to help with this incontinence issue. It's not a normalized thing. You don't have to live with it.
That's right.
And that's what you've decided your specialty is. I mean, don't they call you the pelvic specialist?
Yeah. Yes. And when I first started into this, it probably was about 20 years ago. It was all about using biofeedback and putting electrodes on your bottom and learning about, how breathing impacts your pelvic floor, but also how to do the exercises. And now I think we've come a little further, and we have better tools, and people can see more clearly how their muscles are functioning.
So we just had Dr. Turner, a gynecologist here in town, and he was talking about how even like surgery was the first option. If someone has incontinence, okay, surgery. So maybe you can talk a little bit about the history of management of the pelvic floor and how this sort of came to fruition.
Yeah, and I might just share that patient story today because it was kind of classic.
Yes.
She went to her OB-GYN and told her about she's having a little bit of incontinence, and her gynecologist immediately referred her over to the urologist, and the urologist said, she checked her pelvic floor, which was great, and she said, our problem seems pretty mild, and I think you would benefit from physical therapy. Why don't you call Natalie? So we had a chat, and she asked me about what we do, and I told her a little bit about the education that we do and the tools that we have. And so even if someone does go on to need surgery, learning about their muscles, learning strategies to decrease the, sometimes it's more about urgency and frequency, and there's so many things we can do that really don't have anything to do with surgery or even exercise, but behavioral strategies that we can do.
Behavioral strategies. So can you talk a little bit more about that? Like, what does that involve?
Yeah, so one would be just the way we take in fluids. If I have someone who has urinary incontinence and I always ask them, what they drink and how much they drink. And I ask them, well, there's lots of things, but, and they're drinking 5 cups of coffee and they're having a lot of urgency. We talk about how caffeine can be a bladder irritant for some people. And so it can make you make more urine and make more urine faster, as does alcohol, as does just drinking a whole quart of water at one time. It's just like too much for your bladder. And so the response is, I got to go now. So it sets off our nervous system to get a little bit more. The bladder has a lot of innervation.
I want to talk a little bit about fluid intake because I know even myself, sometimes I forget to drink water and then it's the end of the day and I'm like, I know I'm probably dehydrated.
Yeah.
And I slam a lot of water and then all at once I have to go to the restroom.
Yeah.
And so spreading your water fluid throughout the day helps.
Yeah. Ideally, if you could wake up in the morning and have a glass of water, and then you're kind of thinking 4 to 6 ounces every hour throughout the day, and then you stop a couple hours before bedtime so that your sleep isn't less likely to have sleep interruption by having to go to the bathroom. Yeah, and it just keeps your bladder happy. And the more of your drink that you drink is water, sorry about that, the more of your fluid intake that's water, the more benign it is on the cells of the bladder wall, so it makes your bladder a little less busy. So your bladder really likes water, the pH of water.
The pH. Well,
Yeah.
So, because I know, actually, it's interesting you should mention pH because I know there's a movement towards drinking 8.0 or 8.5, the alkalinity of water.
Yeah.
Do you have any opinion on that?
Not at this point. I didn't actually know that was still a big thing. It was years ago. I was actually at a conference where people were selling alkalinizers, and I think plain water works pretty good.
Good, clean, filtered
just good
water,
filtered water
throughout the day.
Yeah.
And
So when we're talking about pelvic health, what symptoms are we trying to overcome?
So usually we talk about urgency, frequency, and then we talk about what's called stress urinary incontinence. So urgency frequency will happen more like that. You drive into the driveway and you were just fine 5 minutes ago, but all of a sudden now you have to pee and you have to pee right now. Yeah.
I have that.
Yeah. So
thank you.
there's a little strategy you can do when that happens. When you pull into your driveway and you feel that urge coming on, and if you sit still in your car, maybe flip your legs out and you do a few little pelvic floor muscle contractions, just little squeezes like you're trying to stop the flow of urine. Take a few deep breaths and you just fully wait for that urge to pass and then walk calmly into the bathroom is generally a much better strategy than rushing in and trying to hold your muscles tight the whole time. And then you just kind of start training your bladder and maybe spreading out your fluids and noticing, what triggers those things. But you can learn to undo those triggers a little bit. And then the person, the woman I talked to today, she's like, I'm pretty good, but I'm noticing that if I laugh hard or I cough or I sneeze, or if I get on a trampoline and I jump, then she's getting a little bit of leakage.
Yes.
Which is also very common. And that we think of as more of the muscles, maybe just basically the pressure from above is winning over the pressure you're able to create from below.
Okay.
And so then you have a little bit of a leak. So it's not all about the pelvic floor either. It's really about managing the pressure system from your diaphragm to your pelvic floor.
Well, let's talk about that then. What can we do to balance this pressure?
Yeah. Do you want to try practicing?
I would love to actually.
we love.
I don't really want to admit it, but I need to practice whatever you're about to show me.
I need to practice.
We all need to practice. We're doing our bicep curls.
Yes.
We need to be training our pelvic floor too.
That's just it. We exercise all these other parts of our body.
Yeah.
I'm not practicing my pelvic contractions and breathing, but I'm going to start.
Yeah, and incorporating into the exercise you're doing can be really beneficial.
Yes.
Yeah, I certainly notice it when I do the leg press as well. I really have to back off how much weight I now put on my leg press.
Okay.
Yeah.
So probably the first thing that can help is when you're especially doing the leg press is you use your exhale. So use your exhale with the effortful part of the exercise. And that's pretty common. There would be people that would disagree with me because, of course, we have to be able to be nuanced, but that's just a general. But if we think about our breathing diaphragm, and it attaches all the way around our rib cage, and then our pelvic floor, if we look at the muscles, there would be both sides, but it kind of forms a diaphragm as well, from your tailbone to your pubic bone and then out to your sitting bones. So with each breath we take, as we inhale and our rib cage opens, our pelvic floor drops down. So with inhale, breathing diaphragm, pelvic floor diaphragm drop down. That's why our belly pushes out just a little bit. And then on exhale, it moves back up. So it can help to be able to practice on an exhale, because naturally that's the way it goes anyway. And if we cough or sneeze, those are exhale maneuvers, right? So by keeping that pressure system, so if you were to practice this right now and you just notice the space between your sitting bones as you're sitting there, and you take your breath in and you might just notice, does it stay soft? And on your exhale, can you do a little squeeze like you're stopping the flow of urine? And on your inhale, just let it fully release and open. And on your exhale, can you do that little squeeze? And sometimes it helps to do a little shh. And as you inhale, you're going to release and open. I think are you feeling it? You look a little bit like you're
no. I mean, I can like consciously think about what I'm doing and like contracting and squeezing. I can feel that.
Yeah.
Yes.
Yeah. Perfect.
Yeah.
And can you notice the difference of when you try to do that squeeze on an inhale? Because that's the main thing people do. They'll go,
no.
You got to suck it all in, and it's really not as efficient,
working.
right?
Yeah.
But on the exhale, it feels kind of natural and like a little zipper up to your belly button. So your whole little lumbopelvic region is kind of working together for a little bit more support.
So what part are we actually on your model? Like when we do this exercise, what are we strengthening?
So there's our muscles are on both sides. Muscles go around. We're using all these muscles, but the one that's closing off the urethra is like all this pink is muscle. This muscle goes around the opening to the vagina. Here's the urethra, muscles attached to the clitoris. All of them are working together, but it's really the layer just deep to this that's closing the urethra. And then this whole group works together as kind of the reinforcer. It's sort of like a hose on a trampoline. So you want your trampoline to have some nice tautness to it, so that when you step on your hose, close your urethra, reinforce with the trampoline, versus if it's a floppy trampoline, even if this is strong, urine might come out.
So this whole thing of doing sit-ups or something may not actually be the best thing to strengthen your pelvic floor. In fact, it's probably the obvious.
Sit-ups, some people love their sit-ups. So what you want to do is you want to assess, okay, can you do a sit-up, but can you initiate with your pelvic floor first?
I see.
And that's where something like the rehab ultrasound, where we're able to look through the person's bladder, you can see, are they able to do that pelvic floor contraction and hold it as they add that increased pressure from their sit-up.
So let's talk about that ultrasound. You can actually watch that happening.
Yeah, so that's a really nice tool for patients, because like we've talked about, this is a part of our body that we can't really see. We don't know what's going on. And it, although there is a time, and pelvic floor physical therapists are trained in doing internal exams, using the rehab ultrasound allows us essentially to look at the tummy. We look through, kind of like you're looking for a baby, through the bladder, because when the bladder has urine in it, the ultrasound waves can pass through that. So it's like this window to then see the function of the pelvic floor. So when you see that and you do your little squeeze, you see your whole bladder lift up. And if I'm doing that with somebody, and I might see their bladder lift up, but their tummy gets really strong or contracting or flexed, then we can kind of, okay, let's go back and re-educate. The tummy needs to quiet a little bit, and we want to get a really nice coordinated.
Okay, so you're activating the vaginal muscles, but you're trying to keep the tummy muscles in a more relaxed state.
Relatively, but they do work together. So you just want them working optimally together.
Well, it's such an important little muscle group there that sometimes the results of it becoming weak, is this incontinence or laughing and having that little embarrassing, incident. And it's all these things that we can do now that I really didn't even think about. I try to think about exercising, the major muscle groups, but this little micro group of muscles here. Now, is it different for men and women?
So can I just go right back to that for just a second and then go men and women?
Yeah.
Yes.
This is really the base of your core. So if you're doing Pilates or any kind of workout, hopefully you're kind of initiating from your core. So engaging your pelvic floor and your deep abdominals with your bicep curl, with your leg press, that's really kind of what we're looking for. So this can easily integrate into those things. So for men's pelvises are narrow, and then in the deep part, again, it's the same muscles, they're just narrower. And so the area that fits in here is the bladder fits right behind the pubic bone, the prostate is just below the bladder, and then the rectum has to fit down here too. So it's a busy little neighborhood with a lot of nerves, so there's a lot of communication, which is another thing is constipation. So a lot of people that have bladder issues have some constipation. We always ask about constipation because if you have a full bowel, it's like something that's always putting pressure on the bladder.
Oh, I see.
So it makes it a little harder for your bladder to just expand and fill.
So is it the same for men? Would they do the same contraction exercise or is it different?
Such a good question. So for men, there's actually been some research on what's the best way for a man to learn to contract the muscles to close off the urethra. And it's to retract. So some of the terms that are used are retract the penis, or it's like you're trying to pull the penis in towards the body. But the easiest way for both men and women to know if they've got the right muscles is to be urinating and then stop the flow. We say, oh, that's a terrible thing to practice, but really there's been some research on that too, and it's really kind of been debunked. I mean, it's not the best place to practice all the time, but it's a great place to figure out if you know what you're doing.
So like when you go to get that little urinalysis test and you don't want to fill up the cup, overflow the cup, you have to shut it off.
Yeah.
Yeah.
And you're supposed to pee a little bit before you pee in the cup,
yes,
right?
Yes.
So this way you don't pee all over your hands.
Yeah, you start it, stop it, start it, stop it. Okay, so this muscle we're specifically talking about will be helpful for that test.
That's right.
Thank you.
Absolutely. I use that example all the time. And for men, if they've had prostate surgery or a prostate removal due to cancer, one of the muscles that used to work for them automatically no longer works. They really have to learn how to target this particular external urethral sphincter.
So you would see men after prostate cancer surgery.
Yeah. And it's really nice if we can see them for an appointment or two before so they can learn the strategy before there's been surgery, just like we talked about maybe with a knee replacement. Ideally, you get to see someone a couple visits before, learn the muscles, or learn the exercises while everything feels good. And then it's just easier post-op.
Oh, what a great tool. So a couple, 2 or 3, just to learn what you're going to be doing post-op beforehand, and then coming in after for some rehabilitative exercises.
Exactly.
Because you said that men lose a muscle?
Yeah, they lose a muscle. So there is a muscle that's so like part of the base of the bladder where it attaches to the prostate that it is mostly taken out with the prostate. And that was it's more our automatic urethral sphincter. So they have to really learn how to use their voluntary one. So it is really like training your biceps to train that muscle.
Wow.
And men, you think women don't know much about their pelvic floors. Men really don't know much about their pelvic floors.
Well, and that's what's, I love that you brought your models because, it's been a minute since we've all been in biology and health in high school or in college.
That's right.
And then, usually people are not studying this part of the body because it's not talked about as much in the in the gym, or if you see a trainer, you go to a Pilates class. And so this is such an important topic to specifically address an issue that I think a lot of people struggle with.
Yeah, I think that's right.
So the best daily conscious thing you can do is really to even maybe spend a few minutes while you're lying in bed in the morning and really think about taking that deep breath and then
that's a great way to do it, is incorporate it with breathing. I have to say there's also been research on the percentage of people that they think they're doing a Kegel or a pelvic floor contraction and they're not. So we always assess that. Some people think they're contracting, but they're actually bearing down. So yes, you kind of can think that way, but it's really best if you have any concern at all to go in and be seen by a professional. Because the other thing that can happen is there are some people who want to do their Kegel exercises all the time, but they actually have pelvic pain. So some women and men have pain, and it's related to their muscles being held too tight. So it's like if your biceps are always held up here and you're not able to fully let them down, one, you can't pick things up very well, but two, it will start to hurt and cramp. So I'm a little cautious with saying everybody should be doing their Kegels, but everybody can benefit from breathing and awareness of just kind of what it feels like. Yeah.
It reminds me very much of my singing lessons as a child. You were always told to support your diaphragm and hold your diaphragm as you're releasing your breath and still like holding that in and lift your tush, Kelsey, lift your tush.
Yeah.
And I'm like,
And this is the tush they're talking about, right? Because I'll see people that think they're doing their pelvic floor, but they're really squeezing their buttocks, and then it's like, nope, that's not going to close your urethra.
Yeah. So I love that you taught us that one exercise. Is there a couple more exercises you could teach us really quickly that we could think about?
Let's practice a sneeze.
Okay,
so you want to squeeze before
maybe not.
squeeze before you sneeze.
Yeah.
All right,
Squeeze
okay.
before
Tell me what I'm
you
doing.
sneeze.
Yeah.
Okay.
So I'll have people practice just bring in if this is how you sneeze, they tell us to do that.
Yes.
And you're going to do a little pre-squeeze. So you're going to do a little squeeze and squeeze. And you're going to see if you can feel your muscles stay.
Kelsey, practice.
Shush.
To set off your cough. But squeeze before you sneeze, and then you can kind of say squeeze before you sneeze, cough, lift. We'll practice things
I think lifting's a big one for me.
Yeah.
So with lifting, you first, you want to use your good body mechanics.
Yes.
But as you're coming back up, that's your exhale. Squeeze.
So we're
and
squeezing
exhale.
as we exhale.
So you're thinking about letting the pressure gauge out the top. So closing off the bottom and letting the pressure out the top.
Oh, I like that.
I can really feel myself like a conscious effort, that squeeze before you sneeze. Like, I'm going to think about that now, Natalie, when I'm driving. And you think about it when you squeeze 3 times. So
That's right. That's harder. I should have brought some balloons. Something that you can do if you happen to have some balloons is you blow a balloon and you feel, does my pelvic floor drop? Does it contract? And it's okay either way, but you can then try, can I squeeze and maintain the squeeze as I blow? Because that's another pressure.
and I'm glad we're talking about this, because this is sometimes an embarrassing topic.
Oh, yeah.
People are not going to bring this up at coffee with their girlfriends around the table. This is not what they're talking about. But
Did you get your delivery from Amazon?
I know. Have you practiced your squeezes? No, but
Did the big box come?
But it's one of the reasons why Kelsey and I do this podcast, specifically for, helping with education, talking about topics that we see with our clients specifically struggling with, they're embarrassed, they don't want to talk about it. And then we also see sometimes with our clients, like they're not able to stay in their homes longer because they're having so many struggles with incontinence and things. So
that comes right back to kind of what got me into this field. And that was that I told you that I worked with Peggy Buchanan at Vista Del Monte, and she's like, hey, Natalie, do you want to do this training? Because the main thing that keeps seniors homebound is when they lose control, when they have to wear diapers or they're,
Yeah,
they're
absolutely,
incontinent.
yes.
So that was my introduction. But then I started getting more patients that had a lot more complicated things going on. So it turns out it's a big it's a big world down here.
Yeah. Well,
But yeah, that's a key one.
I know Dr. Turner mentioned that there's not enough of your specialty. Quite
Right.
frankly, he says you guys are like booked all the time.
Yeah. Well, especially at the hospital. So where I am now is we're not an insurance-based practice, so it's a little different. At the hospital, one of the things I loved is we treated everybody, but it sometimes could take 4 or 5 months to get in. So there's pluses and minuses.
Yeah.
But
You need a podcast.
it's the nature.
Yeah. The pelvic floor podcast.
Pelvic PT.
Yeah.
Sneeze. No, what is it? Sneeze and
Squeeze.
There you go.
Squeeze and
Sneeze.
sneeze. Goodness grief, get it straight if you want help. It's squeeze, then sneeze.
Oh my goodness.
Oh, jeez.
Dude,
Well, share with us, Natalie, maybe some just success stories, people that maybe came to you and they just thought it was hopeless.
Well, the most straightforward folks are usually men, because it's a little less complicated. This one thing happened, and then they're leaking a lot, and they have to start learning to trust that maybe they don't have to wear a pad for portions of time, and I have to talk them into that, and then they just keep progressing from there. Sometimes very often there's a big shift just after visit number 1. And I had that happen recently with a patient, a woman. She was actually there as a caregiver to her husband who'd had prostate cancer. And she's like, well, maybe I could do this too, because she had had some issues ever since the birth of her babies, and she's now well into her 60s. And just after the first visit and just having more awareness and that she had some element of control, she was already noticing that she was having less leakage. So the beginning can happen really quickly because you shift from maybe how you do your fluid intake. You just have a better idea of how to engage the muscles in your daily activities. So I think the biggest shift happens really early, and then sometimes it's kind of slow, and then we have to figure out what else is going on, and then we're usually oftentimes, because it has to do with our nervous system too. It's not just the muscle. So if we're busy all the time, it's sometimes hard to slow down and go, okay, this is what I need to work on. I need to take a few deep breaths. I need to let myself just take the time, because it doesn't take very long to practice once you know what you're doing.
So you're saying that there's a good reason why men take so long in the bathroom for actually doing
Maybe
pelvic?
because they relax. Well, they might relax.
Maybe they're more relaxed. Maybe we're just always so busy as
We're
women.
always so busy.
Got to hurry up and get in the bathroom.
Yeah, when you're in there going to the bathroom, you want to sit there and you want to just in order for the urine to come out, we have to be in our parasympathetic or our relaxed part of our nervous system. If our brain thinks a saber-toothed tiger is coming or anything that's stressful, we may not fully empty. And that might be a reason why, darn it, I just went and now I have to go back into the bathroom. So when you're done, you just go, can I just relax a little bit more?
Well, I can tell you, being a teacher for 20 years, believe me, I was on a bell schedule. And when you run to the bathroom, I guarantee you, I didn't completely sometimes empty my bladder because the bell was ringing and I had to be in class.
So, and you don't get very many opportunities either.
So I think they called it a teacher bladder at one time. Because,
and nurses' bladders too.
Yes, with people that are on shift and you can't just casually walk over to the bathroom. And so,
I mean, we've talked a lot about the urinary, but is there something with the colon as well?
So people can also have incontinence of stool. And, you think bladder incontinence is difficult. People have incontinence of stool is even more embarrassing and, again...
And uncomfortable.
And it's also nuanced. So sometimes people actually have constipation, but then stool builds up, and then they can actually have some involuntary leakage of stool around that constipated part. Sometimes I have someone right now who it turns out her muscles are kind of holding so tight, there's not much room. And so again, it often boils down to being able to relax and get full ability to lengthen the pelvic floor to create more space. And also to more fully empty when we're in the bathroom. So any strategies and tools that you have, and I talk a lot about constipation, putting your feet on a stool. The reason we put our feet on a stool is there's this muscle that goes deep. It goes from the pubic bone and it goes around what's called the anal canal. And so if here's the rectum and here's the anal canal, which is where stool comes out, when we put our feet on a stool and we're in a squat position, it basically just opens up that angle and makes it much easier to pass the bowel movement.
Fascinating.
And for some people, it's even easier to empty their bladder when they do that. It helps them just get into that squat position, but you're in a supported squat. So,
I mean, you're talking like a small stool, right? Like 8 inches?
yeah. So it depends on how tall the person is. But yeah, they're all over Amazon too. But 6-inch, 8-inch, or you might just have a stool already at home. But that's the idea: is back is straight, but the knees are up a little bit higher than the hips, and then your whole foot is fully supported. We can't go, I'll just go up on my tiptoes, because the nerves that innervate the pelvic floor are part of the sacral nerve roots that also innervate your toes. So you're activating those muscles, and you're trying to
relax them. And so you're by being on the stool, it just allows you a chance to get in the right position to allow the bowel to not be kinked.
Yeah, exactly.
Yeah.
You need a meditative mantra that you need to
And
teach people.
there are people who've made those, and I'll sometimes
that's awesome.
give them.
Yeah.
I was at a course where the woman made a whole series called Meditations for Pelvic Health, and one of them is toilet track.
Oh, yeah. No, but I mean,
Number 3.
So much of
Number 2.
so much of that's, it's up in our head. It's just getting us to just relax. And I even find that with myself. If I'm rushed, I won't even give it a go in the morning. I'll just be like, I got to get on with my day.
Yeah.
And I make that a part of my practice, to be more mindful, to allow myself space to place and be there and relax.
Yeah. Give yourself that little extra time.
Yeah. Wow.
Totally.
Well, I mean, I've learned so much. Thank you for informing me, because I'm going to practice that that technique in the car before I'm running to the door to see if I can get things calmed down. But
I just also learned, especially around exercise, and really paying attention to that breath out and being supportive.
Yeah,
That's a really nice trick. Thank you.
Yeah, you have to tell me how it goes on the leg press.
yeah, we're
I'm still able to do the 180.
Yeah. So before we close up, though, what are your top suggestions if people they're uncomfortable talking about it? Where can they seek help for this issue?
Well, usually if at your annual exam or you're seeing your general practitioner and you let them know that it's a problem and you ask for help. There are actually several small private practices in town now, but there's also Cottage and Sansom also have pelvic floor therapists. And I think you have to advocate for yourself, because the doctors have a lot of things to think about, and they might be more concerned about some really, medical concerns for you. But this could be a really important part of a person's quality of life.
Right, I keep them at home, as you pointed out.
And keep them at home. So I think you have to be an advocate for yourself and ask for resources. And now it's as easy as you can Google pelvic floor physical therapy in Santa Barbara. You can certainly call us at Heart of Gold Physical Therapy. But there are still a lot of us in town.
Wow.
And people need to ask.
Well, that quality of life and dignity, to be able to not be afraid to go to the Granada or go out to the theater or go out to dinner with friends, and to be able to lose that part of aging and lifestyle because of this problem, or maybe it can be helped, to be able to continue through your senior years with a healthier pelvic floor.
Yeah. Actually, can I throw in one more thing?
Absolutely.
So that with the women in hitting menopause, and even as we're in perimenopause and into menopause, the vagina is a very estrogenized part of our body, and we lose estrogen big time. Or a lot of the people I work with now are people who have breast cancer, and breast cancer treatments often eliminate your estrogen. And so vaginal estrogen is super important to help remake the resilience of those tissues, and it can help with urge urinary incontinence, stress urinary incontinence. And people are still fearful that it can cause cancer, and there is absolutely no connection between that small dose of vaginal estrogen and cancer or blood clots or heart, anything, because it doesn't even change your systemic levels of estrogen. But people will sometimes get it, take it home, has a black box warning on it. Now menopause is like hitting big time, and I think women are learning more, but still, and it's the best way to prevent urinary tract infections. So I think vaginal estrogen should be a little flag on it.
Well,
it's very important. I know I was actually just speaking to someone about this morning, actually, funnily enough, and she said, well, I gave up doing vaginal estrogen because it was a cream and it was just got all over me and I disliked it. And it's like, well, did you know that there's a vaginal insert, a capsule? No, and it's like, no. It's like, and I agree with you, especially after talking with Dr.
Turner, boy, he debunked some real myths around that whole estrogen.
So yes, you are
good.
You were definitely supporting what he said,
Yeah,
and estrogen is a very important hormone for us females.
Well, it has been an empowering podcast for me, and I hope that our audience has enjoyed this. We will put links in the bottom of the program for the Heart of Gold physical therapy and resources. And if you enjoyed this podcast and you want to share it with friends and family, push the button and share. And it's been my privilege here today in Santa Barbara with Kelsey
Thanks
and
so much,
Natalie.
Yeah, thank you. It was fun to be here.
Yeah, really wonderful.
Thank you for taking time out of your day and sharing this topic with us. As we conclude this eye-opening discussion, remember, pelvic health is a fundamental part of overall well-being. And by understanding the pelvic floor and adopting healthy habits and seeking professional support, seniors can maintain independence and live very comfortably. We hope Natalie's insights encourage you to have open conversations and to explore the resources available. Thank you for tuning in to the Senior Scoop. Join us next time for more expert guidance on aging gracefully.